Hello, I'm Dr. John Abebe, the Medical Director of Jojo Abebe Fertility Center and the lead tutor at the Jojo Fertility Academy. This is my pleasure to be introducing to us today the basic fertility training program for nurses. Now we have the fertility training program for nurses have three different packages, starting with the basic fertility training. Then you have the advanced fertility training before you go on to the practical training program. And so today I'll be introducing the basic fertility training program. Now the basic fertility training program for nurses has 5 modules that are made up of different units. You have it, the module 1 has 3 units, the module 2 has 4 units, the module 3 has 8 units, the module 4 has 3 units, and then the module 5 has 5 units. Now, the module 1 is Introduction to Reproductive Medicine. Now, as the basic fertility training program, the module 1 is to introduce the students, the nurses, to the Introduction to Reproductive Medicine, where we look at the definition and scope of reproductive medicine, the history and the scope of fertility care, and then we wrap up with the role of a fertility nurse. And then the module 2 will be looking at the female reproductive system. And then in module 2, we will look at the external and internal genitalia, excuse me, then the embryology of the female external and internal genitalia, and then the hormonal regulation of the female reproductive system. And that basically just giving you the anatomic overview and the physiological overview of the female reproductive system. And then the third module is the male reproductive system, where we shall be looking at both the external and internal male genitalia, the embryology of the external and internal genitalia. We'll look at an overview of spermatogenesis, the production of sperm, and then we'll look at the hormonal regulations of the male reproductive system, and then look at the common disorders of the male reproductive system, and then diving into specifically the overview of the role of testosterone in the male reproductive system, and look more specifically at the role of testosterone in spermatogenesis. And then once we're done with the third module, you go to the fourth module. The fourth module will be looking specifically at the causes of infertility. Now, you have the female causes, you have the male causes, and then you have the unexplained infertility. And so that is what the module 4 will be looking at. And then module 5 will be looking at diagnostic assessments in infertility. That's what module 5 will be looking at. We'll look at the diagnostic assessment in the female infertility and male infertility. We'll look at the initial workup for infertility programs, looking at the detailed patient history and physical examination. We'll look at understanding and interpreting diagnostic tests in infertility. We'll look at ultrasound evaluation of reproductive organs, and then more specifically looking at identifying follicles, ovaries, and the endometrium on ultrasound. And then we'll look at the timing and the monitoring of ovulation. And lastly, we'll look at semen analysis and the interpretation of results. And so that would conclude the module 5, and these 5 modules forms the basic fertility training program for nurses. And once you're done with these courses, then you can now go on to the advanced fertility training program for nurses. So I hope you have a wonderful time going through this course outline. See you in module 1. Bye.